Hey everyone, just before we jump in, I wanted to quickly issue a trigger warning that in this episode we discuss eating disorders and there are descriptions of disordered eating behaviors. So if that is not something you are interested in listening to today, then just skip this episode.
Hello, welcome back to another episode of Make a Living. Today we have Dr. Zoe Ross Nash, who is a clinical psychologist specializing in eating disorders. She is awesome. She's 30 years old and she just started her own private practice after many years of experience in the subject matter. I really love this conversation. I think it is super, super fascinating. And I'm so grateful that someone as passionate and intelligent as her is in this career path to help individuals. She also talked about many of her sort of tangential passions outside of her day job and how she views her days more holistically, like her interests span beyond just simply a therapy one-on-one setting. So enjoy this episode. Zoe, welcome to the Make a Living podcast.
Thank you for having me. This is so exciting.
I know. Have you done a podcast before?
I have a podcast actually, on yes, on eating disorders. So I'm so sad that my professional mic isn't working right now.
Well, I guess since you just mentioned it, what is the name of your podcast?
Yeah, so my podcast is called On the Mic with Ed, and it's about eating disorders. And we talk about conversations all related to eating disorders and get into really niche conversations like on the mic with GLP-1s or on the mic with binge eating or even featuring someone who got gastric bypass and just having conversations about what it's like to live in this world with a body.
And do you usually have guests or is it you and a co-host?
It's me and a co-host, but we do have featured guests just to make sure that we're getting the best specialists possible to talk about a topic.
So I'm so excited to talk to you today, Zoe. I guess let's start off. What do you do right now? Of course, you have the podcast, but as your full-time profession, and then we will talk about how you got there.
Yes, I do have a podcast that is very much a passion project. I am a licensed clinical psychologist and I specialize in eating disorders and trauma. Right now, I actually, like 3 weeks ago, just created my own private practice and I'm on my own, which is really exciting. And I see clients weekly or bi-weekly or whatever they need and work with the collaborative care team. And that is how I spend most of my day.
Awesome. And so right now you're full-time private practice. You don't have like another. Okay.
Yeah, full-time
Um,
practice.
Awesome. Yeah, my sister was on the podcast a few weeks ago, and she is a therapist. Social work is her degree, and she like tested the waters of private practice while working full time, and like was about to make the jump fully to private practice, and then ultimately found the job she has now, which is like telehealth therapy, working for a company. So, okay. And how old are you, Zoe?
I'm 30.
30. So let's go back to, I guess, well, you tell me actually, when did your passion or interest in, or the idea of becoming a psychologist start? Where did you have an interest in going into a career focusing on eating disorders from an early age? Like, when did that sort of peak in you?
Yeah, great question. And a complex one. So I was a very serious ballerina all throughout my early years and even into college. And I saw eating disorders impact so many people in my community. But particularly psychology, I took a AP psychology course my junior year of high school. I did not do well in it. Like the teacher actually said, Zoe, I think you should step down from this. But I was really stubborn. And I said, no, I want to finish this out. I got like a C in the class, but somehow got a 5 on the AP. No one knows. She was like, I've never seen anything like this before. So from there, I learned what a PsyD in clinical psychology was, I think literally my first day of junior year of high school. And ever since then, I catered my entire academic career to pursuing this. And then eating disorders came from my own community being impacted by this severely deadly concern. And then I have a family history of eating disorders as well. And that is my main motivation too.
Wow. So you really had an interest from an early age. And like, as you said, like that was, you had your eye on this path. I'm also interested, and also shout out AP Psych. I actually got an A in AP Psych, but a 3 on the test. And it was like kind of like everyone was like, oh, the AP Psych test, like you'll get a 4 or 5 if you have good grades. And I was like, how did I manage? I got a 3 on every AP test, which was just like, okay. Um, will you talk a little bit about the pressure of being a ballerina? Because I've heard this before. I'm not a dancer, but I've certainly heard that that's common. Is it like desire to fit a certain aesthetic? Like, what is
There's
why does the eating disorders arise? I guess, do you think?
an immense amount of pressure. When you think of a ballerina, what do you immediately think of? Someone thin and slender and easy to lift up. So there's so much pressure to look that part. And then we also have pressure of fitting into costume. So a very unspoken about topic is costumes typically get passed down from generation to generation. And if you don't fit that costume, you don't get the part. And there's that pressure to be similar in similar bodies as the person who was in the part before you. And
Mm.
that creates a lot of desire for control of how your body looks and presents, and usually eating disorders slip into that after that point. But the pressure to look a certain way when you're constantly looking in the mirror at ballet,
Mhm.
I mean, you're just going to get very hypercritical of yourself, and a tights and leotard, it's not very flattering on anyone. So there are just so many external factors that make us hyper aware of our body and the way that we take up space.
Yeah, absolutely. Whereas maybe some other forms of dance are less fixated on like actual physique and shape. And also, I'm curious, as someone that is very tall, I'm 6'1", does height come into play with that? Like, is there a special height for ballerinas?
Oh gosh, great question. So I stepped out of the ballet scene when I was like 20 years old. My mom was actually a professional ballerina, so she could probably speak more eloquently on that sort of aspects of things. But I would say there is a ideal height, like a Goldilocks height. You don't want to be too short, you don't want to be too tall. You want to be able to have that like long, lean line that short people might not be able to obtain, and too tall would be able to be partnered. So
Mm,
there's this, as I said, Goldilocks height and
yeah.
weight.
Wow. Definitely intense. Okay. So as you're exploring going to get your undergrad degree, did you pick a certain university or program that specialized in psychology?
I didn't. So I picked Elon because they had a fantastic dance program. And at the time, I wanted to major in dance and I was uncertain of what I wanted to do. And I'm actually the first generation college student in my family. My brother attended college, but my parents did not. And we didn't really know how to go about the college experience. So when someone said, "Oh, Elon University has a great dance program and it's in the South and it's warm," I was like, "Winner, winner, like, let's go." And I applied their early decision and got into the dance program. And I won their scholarship, actually, which was a bonus. And I didn't really look into the academic aspect of it. My brother also went to college for sports. So we were not looking into, does this university have a stellar psychology program? Because we just didn't know that that's what something you should be doing at the time. But now that I do know, Elon University doesn't have like a fantastic psychology program, but they have really cool ways for you to get experiences. I got mine through a lot of volunteer work, and that's how I gained a lot of clinical experience, even in undergrad.
I think too, given your degree is like it's a doctorate and it's a higher education degree, it's like you're going to have to go to another secondary university anyways. So perhaps it's okay if you don't fixate on it. In college, I actually just interviewed two of my friends who are both in med school right now to become doctors, medical doctors, and they both studied psych and like at a liberal arts school and did not at all do pre-med. So it's possible for any listeners that are in college or want to do psychology, you can pursue it post college. Then when you were, I guess, leaving, did you know that psychology, becoming a psychologist was the path, or was like psychiatrist, social work, any of these other mental health related professions in the running?
They weren't. So that, again, my own like naivety kind of led me into the PsyD and clinical psychology. I didn't know of other things. My mentor in undergrad had a PhD in clinical psychology, and he was like, "Oh, do you like research?" I said, "No." He said, "Okay, then do a PsyD." So I was like, "Okay, sounds good." And this is
Mhm.
where I applied. So I didn't really look into other career opportunities or other degrees. So I only applied to PsyD and clinical psychology programs. I applied to one PhD. From there, straight from undergrad, I went into grad school, and I have some mixed feelings about that. I wouldn't change my life as it is now, but I kind of wish I took a little bit of time in between. But no, I never looked into med school or social work or mental health counseling. I was always looking in the clinical psychology route because my mentor did that.
And PsyD, what is the research like? What is the flip side?
Yeah. So, a clinical psychologist and getting your PsyD like I have, you do predominantly clinical work. So, sitting with a patient, whereas getting a PhD, which is a philosophy degree, is more about research and exploring statistics and related to psychotherapy or pathology that I would be sitting in the room with.
And then PsyD, what does the D stand for? You might have just said this. Is it doctorate?
Doctorate. It's a
There you go.
doctorate in clinical psychology and it's a PsyD, whereas like a PhD is a doctorate in philosophy in like clinical psychology.
What is the time commitment in terms of schooling to get into to graduate with that degree?
Yeah, so I attended Nova Southeastern University in South Florida, which was so much fun, from 2017 to 2022. But It's a 5-year program. Some are 4, some are 6, some are 7. Mine was just 5, and I graduated in 5, which was also common with my university, where some people take longer even if the program is 5 years. So the way my program was set up is your first year was all academics. You only sat in the classroom. You learned about pathology. You learned about conceptualizations. You learned about theory, and you did like what we call practica, and you practice on like fake patients and practice on each other and did a lot of role plays. Brutal. And then second year was where we actually got involved with patient care. And I would say it was like 75% academics and 25% patient care. And then third year was 50-50 academics, patient care. Fourth year was 75-25 patient care to school. And then what makes us a clinical psychologist different than other sort of degrees is we actually do what most people call residency, but before we graduate. So I did 4 years of grad school and then was what we call a pre-doctoral intern on our 5th year. So I wasn't graduated until my 5th year, which is pretty common for PsyD programs. So we don't become doctor until we finish our pre-doctoral internship. And then my 6th year, I did a postdoctoral fellowship.
And well, what I was going to ask is, where are you from?
From New Jersey. Yeah.
Is there a reason you kept going south? Was it the weather? Did you pick that university in Florida for a reason?
Yeah, I did actually. So I went south because my brother went to school in Chicago, and I was like, nope, don't want to do that. Way too cold. And then so I went south for undergrad. And then my parents were looking at moving to Florida. So I went to school on the east coast of Florida, and they moved to the west coast of Florida. And I'd spent so much time away from family already with 4 years in undergrad. I wanted to be closer to them. So I was actually really fortunate that I got into the program. They had just moved, and I was able to see my parents monthly, which was really crucial during that really difficult time of grad school. Since then, I've moved very far away. I moved to California. I moved to St. Louis. But it was really wonderful that I was able to have them so close during such a difficult time of life.
Yeah, absolutely. And when you were in school, did you start focusing on eating disorders while still studying, or did you do that after?
I knew I always wanted to do eating disorders. I coined myself as like the eating disorder girl in my program, and I was the president of the Eating Disorder Awareness Association at my university for 2 years in a row. And I did my dissertation on eating disorders and the correlation of trauma and the function of eating disorders post-traumatic experience. So I knew that this was all that I ever wanted to do. Even all of my practica where I was with patients were catered towards eating disorders. So whether or not I was working with eating disorders themselves, I was working with substance use, I was working with healthy lifestyles, sleep issues, trauma. And then when we finally were allowed to work with eating disorders, because they are a very complex disorder that needs a more seasoned therapist to start working with them, I didn't really start working with eating disorders until my 4th year of grad school, where I trained at the Renfrew Center in Coconut Creek, Florida, which is a residential treatment center for eating disorders.
Would you mind telling me a little bit about, would you say it's your dissertation that was about eating disorders and trauma?
Yeah, absolutely. So it was on the function of disordered eating in the wake of a traumatic experience. And the overall idea, which is no one's shocked by this, that the more recent the traumatic experience, the more likely the eating disorder pathology would be more severe. And then also age of onset of the trauma, 12 and younger, typically predicted more severe eating disorder pathology and also more impulsive chaotic pathology. So like a binge eating or a bulimia type pathology. So most people use an eating disorder as a way to cope in the wake of their trauma because it helps you find control. It helps you find meaning. It helps you punish yourself in some ways. So a lot of people end up using their eating disorder as a way to understand their trauma or feel in control of their trauma because they have no control of what happened to them.
Mm, that and I hope these follow-up questions aren't ignorant, but I'm very, curious about eating disorders and everything that you just said, because I do feel like probably everyone listening knows someone, or maybe they've experienced an eating disorder themselves. And as a female too, I think it's very common to just, you mentioned at the top the way you phrased, I don't remember what you said, but like as humans living in bodies, like just your body as a female, maybe I should speak for myself, but I think my friends would relate, is such a focus and like topic of conversation. And it's luckily as I get older, it's becoming less and less of a focus. But for sure in high school, college, my 20s, it was, I feel like such a focus. And although I will caveat with that by saying now with GLP-1s, it's kind of coming back into the forefront. How common is it that like eating disorders are coming from a place of like there was a trauma experience like you maybe just described versus daily like daily traumas, I guess, of like to fit in or like go like yeah, just like feeling like maybe like the ballerina experience, maybe like how frequently maybe you consider that trauma. But does that
Yeah.
make sense? Like how frequently is like there an event versus just daily things that lead you there?
It makes total sense. So what you're actually differentiating between is something called a big T trauma, which is what we call as like a car accident or a sexual assault. And then there's little T traumas, which are those micro experiences that really invalidate us and chip away at our ego and our sense of self. So 1 in 4 people with an eating disorder do have PTSD and have experienced a clinically significant trauma. I would argue that like every single person has experienced trauma. There's a statistic that 90% of the world has experienced trauma. So it is likely that someone has been through a traumatic event more often than not, 9 out of 10 times, right? So whether or not they're developing PTSD or whether or not they're developing an eating disorder, they're still having this traumatic experience. And then whatever happens as a result of that, it could be resiliency, it could be an eating disorder, it could be PTSD. So I feel like I'm kind of skewing off your question there. But in sum, I would say almost everyone has had some sort of big T or little T trauma if they have an eating disorder.
Yeah, that makes perfect sense. Would you mind defining, I'm guessing there's more than just the two eating disorders I think most people know of, which is anorexia or bulimia. I know there's also orthorexia. I don't know if that's an official diagnosis, but I think it is. There's also like people talk about emotional eating. Would you mind defining what anorexia is and what bulimia is?
Yeah, great questions. And there are so many different types of eating disorders. So there's anorexia nervosa, which is categorized as significant intake restriction and being in a caloric deficit. We do use the BMI to indicate severity, but only 6% of people with an eating disorder are actually underweight. So we use this term as it's called atypical anorexia, and it's for when someone is not underweight, but they're still displaying all of the symptoms that you would see in anorexia. But in reality, it's actually typical because only 6% of people who are restricting are underweight. So that's anorexia, that restrictive type tendencies. Then we have bulimia, which is binge purge behaviors. And then we have binge eating disorder, which is just binging, no compensatory behavior. And then we have other specified feeding or eating disorder, which is when someone is displaying signs of an eating disorder, but they don't necessarily fit into that very stringent criteria. And majority of people are diagnosed with other specified feeding or eating disorder just because of how strict the criteria is to be diagnosed with anorexia, bulimia, or binge eating. Orthorexia is actually not a DSM diagnosis, but it's very common in like colloquial language for us to know what we're talking about when
Mhm.
someone says, "Oh, I have orthorexia." It would probably be considered like that other specified feeding or eating disorder.
Yeah, I had a period when after I graduated college where I was like, I don't think there's a term, but I was healthy obsessed, and I would actually more define it by as anxiety. Is like the way it manifested. It was thoughts about health and food and exercise, but the thoughts in my brain were crippling. And so I had to get help. Luckily, thank God that through working with therapists, I was able to get out of that phase of my life. Okay, so you mentioned where you worked. I think you were saying in your 5th year, that center, that is where people go and they live there if they are struggling with eating disorder. Okay.
Yeah. So it's a residential treatment center. So you live there and you do skills group, you do individual therapy, you get dietetics counseling, you get psychiatric support. And I also just want to thank you for sharing your story. Like so many of us have that experience. And if we can just like say it out loud and know that we're not alone, I feel like so many people will get help. And also I like to remind people at any time in your life, you can get help. There's no such thing as not being sick enough. If you have a concern, go see someone, go chat with someone. You deserve to not have that weight on you.
Thank you. Totally agree. Like get help. Like I think I at one point joined it was like a wellness circle and people were like sharing stories and just hearing people share stories. Like I did so much of that I'm 31 now, but like in my 20s, I really recommend like the amount of I referenced on another episode, like the amount of like self-help things I guess that I did in my 20s. And it sometimes in the moment you're like, is this stupid? Or like I didn't talk maybe about it in the moment, but now I'm like, I really recommend just explore those things. And honestly, it could even lead being talking on a podcast about careers, like it could lead you to be like, I actually kind of want to go like be a therapist or be whatever that person's doing. Um, okay, so I was curious when people go to a center like that, like a residential center, is that covered by insurance? Like what is insurance like for this type of care?
Bryn, that is a tough question. Yes and no. It can be covered by insurance. And insurance is notorious for cutting people's services short when they make a marginal amount of improvement. And ultimately, a lot of people end up having to pay out of pocket for those services. For a long time, eating disorders were actually not covered by insurance. Fortunately, that has changed. So the program where I trained at, they did accept insurance and accept most insurances and were really great advocates for making sure that people's care was covered. But we would see people gain X amount of weight and then their insurance would cut out because they
Mm.
didn't think that they were worthy enough for a high level of care. Going back to that idea that only 6% of people are underweight with an eating disorder. So they were engaging in significant restriction, but since they weren't underweight, the insurance said, oh, their BMI is normal. Well, they don't need higher level of care anymore.
What's like the general like length of stay if you are admitted to a center like that?
There is none. I saw people there for like 2 weeks, and then I saw people there for like 3 months. So it really determines like, it's determined by your severity, it's determined by your financial ability or your insurance coverage. There are so many facets that intertwine with why someone stays there. We had someone stay because they were unhoused, and we needed to figure out a living situation for them when they stepped out of treatment.
Mm.
So we supported them until they could get adequate housing. So there's so many reasons why someone is there versus not.
So how long ago did you officially graduate?
August 2022.
Okay. So what was your first full-time role coming out of the program?
Yeah, so technically, I worked at the University of California, Davis as their predoctoral intern there in their eating disorder emphasis area. That was technically like my first like 9 to 5. But then after that, I transitioned into a group private practice that specialized in eating disorders and also training people to learn how to treat eating disorders. And I worked with them for 3 years. And then actually recently, when I stepped into my own private practice, is when I stopped working with them. And I really loved training future clinicians in treating eating disorders just because I think 0.01% of therapists specialize in eating disorders.
Mm.
So I wanted to be part of the community that trained more people to know how to deal with this.
Absolutely. Um, I'm surprised it's such a small amount. Were you in California or did you do that remotely?
I was in California. It's actually where I met my husband. We met like 2 weeks to me living there, and ever since then, I we fell in love, and now I move around the country with him.
Oh my God, amazing. Okay, cool. And so did you then become remote when you moved to St. Louis or
Yeah. So for folks listening at home, my husband is in the Air Force and we move around frequently, which is very difficult with my career, just because different states require different requirements to be licensed in. So I had been licensed for literally like 2 seconds. And we moved from California to Illinois. And I had been established in California. I'd made all of these wonderful relationships in my career in California. And then we picked up and moved. And so I stayed actually remote working West Coast hours in Illinois in Central Time for 2 years, and it was pretty damaging to my work-life balance. So I would be working until 9 p.m. most nights, and I didn't get to see my partner, and I didn't get to go out to dinner with friends, and I didn't make many friends because I just didn't have availability to. So there is now with COVID and licensure mobility, there's much more opportunity to move around with this career. But when I was figuring all of this out, there wasn't a lot of opportunity for me. Fortunately, as a military spouse, they do give me some grace. But yeah, moving around with this career is very difficult.
Yeah, absolutely. You just touched on it a little bit yourself when you mentioned like your own sort of mental well-being during this challenging time. Are there tools that you've implemented or do they teach you in school of like how to protect your mental health dealing with such challenging conversations during your workday?
Absolutely. And my supervisor, when I was in my trauma clinic, said if you start seeing trauma everywhere, you need to check in with yourself because you are sitting with people in the deepest, darkest moments of their pain. Of course, it's going to bleed onto you. And doing your own self care practices of emotion regulation and compartmentalization and all while trying to stay warm and empathic and human while they're navigating this and while you're navigating it with them together, it's a very delicate dance. So I make sure I structure my days in ways that I can really attend to my clients while also attending to myself. I don't see more than like 5 clients back to back to back because I know that my capacity stops at that point. And I always take that break. I always take a lunch break. I make sure that I'm fueling myself. I keep water on my desk whenever I like can get to it quickly. So there's a lot of self-care that is required in this career, especially if you're working with more intense experiences like trauma or eating disorders. So that was what I learned from this change.
Absolutely. Wow. And do you ever work with other mental health professionals while you're working with a certain client?
Yeah, collaborative care is one of my favorite aspects of this work. I love hearing the brains of other talented clinicians. In terms of like therapy, it's a little complex because technically one person or two people are two or more people are not supposed to be treating the same person for the same condition. And the way I do my work is I see from a very contextual lens. Even if the trauma is not related to food, like it still somehow connects to the food. So I typically don't split my treatment, but there have been times that I have. So I would not say that I'm an OCD specialist. So I worked with someone on their eating disorder while working concurrently with someone who was doing exposures with an OCD type experience. And in that time, we got a release of information. I chatted with the specialist to ensure that we weren't crossing over, to ensure that we were doing ethical care. And then also it just gave such incredible dividends of seeing the different experiences that I was having as a clinician and she was having as a clinician, and we were able to really deepen the work.
I love that. And that reminds me too, I'm sure you're working with nutritionists or dietitians at some point, especially at like the residential center that you mentioned. Did you ever consider a career in that?
No, I didn't. The mind was always curious to me. Like I love just I loved understanding people. The weird thing is I wouldn't really consider myself like too much of a people person. I wouldn't say I am the one like socializing and like meet like going out and introducing myself. I would way rather be on the side of the corner of the party, like chatting with one person and like really hearing about their experience. So that's how I interact with this world. But I wouldn't
Yeah,
necessarily say the food stuff.
totally. Okay, so one, you're so similar to my sister who I had on recently.
It's
But I also relate to that, like, and I am known as, first of all, you also seem from when I met you, you seem very extroverted and like a people person, but I hear you. I think I agree. Like, I get bored quickly, like, just with like big parties, like surface level, and I'm immediately like lock in. And I joked on some of the early episodes of this podcast, like, I would be the one at the party and being like, do you like your job though? Like, are you like happy? Like as you're, I was like every hour of the day, like, are you happy? I was doing it selfishly, trying to be like, am I alone? And anyways, hence why this podcast, I want people to not feel alone if they are questioning their path. So I had a roommate right out of college that was a dietitian. Shout out Mindy. And she was just graduating from BU with her master's, and I was always like, oh, like, and she was interested in a lot of the same things as me socially. Like, she loved running, she loved working out, like, she loved cooking and making healthy meals, and I did too. But then I was like, oh wait, I like hate science, so like I would never want to do that. And like all of like the science related and like nutrient level details, I was like, oh, that's not what I like. Also, to like endocrinologists, like hormone health, like women's health. I should just say women's health is kind of what I've always loved. But I'm like, but I would never want to be the doctor. I'd want to be the person like in the support room being like, you're going through like an IVF treatment and like whatever. So I don't know what job that is, but I love that mental or yeah, psychological aspect of it all as well. Okay. So you have very recently transitioned into private practice. What made you make that switch and like what has been exciting about that, but also challenging?
Yeah, and before I answer that question, I just want to say create the job. Like, why not? Like, if it's not there, you create it. Like, why not figure out a way that you can be a support person in women's health? So, I am really passionate about fitness, but I see how pathological fitness spaces can be for people with eating disorders. So, I created a fitness training program for professionals to become eating disorder informed. And I work with fitness professionals on how to understand how to ensure safety in their classes. So,
Super cool.
like, if you have I'm someone who also has a lot of, like, occupational novelty. I don't like to sit still for too long. I like to do a lot of different things, and I have a lot of different loves and passions, and all evolve in and out of things, and that's totally okay. Like, I do this podcast now. I probably won't do it forever. That's okay. And just having compassion and grace with yourself that, like, I might not be a psychologist forever, but I'm really loving it right now, and I will figure out whatever the next step is for me.
Oh, I
And just
love that. I
being
also love the term occupational novelty. That's so good. Like so many interests. And
yeah.
I love that you're doing that. That's super cool.
Yeah, I do a training. I am a supervisor. I am a clinician. I am an editor for a journal. And I love multiple streams of income is something that I really appreciate using my brain in different ways. So that's like, why not, right? There's no reason why we have to be stuck to one identity or one lens. We can be so dynamic in who we are in our career.
Yes.
But to answer your question, what's been the hardest? No one taught me how to run a business when I went to school for a zillion years. So, like, I sent out a mass Snapchat to my friends and I was like, has anyone ever used QuickBooks before? Or, like, should I use, like, the Wave? Like, what other things? Like, zero idea. I was like, what's a write off? How do you decide these things? How do I brand myself? Like, what color is appropriate? What's a good name for a program? Like, these are things that I just had no idea what to do. And that's when I really leaned on my support system and people who are way better at these things than I was. Figure out, what do I do next?
Totally. Super cool. And yeah, like even probably setting up insurance. Maybe you knew a little bit about that from your jobs and like probably having clients use insurance, but like that's a whole nother beast, I'm sure, and like billing and all of that. So yeah, so what is the licensure situation like? Like if you move, do you have to like for private practice get a new license?
It depends state by state. Usually you can move to a state and practice remotely as long as the patient lives in the state that you are licensed. So as long as they live where you're licensed, you're usually okay. I have something called SIPAC, which allows me to have interstate jurisdiction where I can practice in like 43 different states, which is wonderful. But if we may be moving back to California. We may be moving to DC. We might be moving to Germany. I have no idea. So with that, I have to look into the state laws of one, how to run a business, two, how can a psychologist run a business, and three, what are the licensure limitations that I would need to do? Do I have to get licensed in this new state? If I do want to do in-person care, which I didn't do during this move because we weren't going to be here that long, it didn't feel worthwhile. I would have to get licensed in the state to provide in-person care.
And I wanted to ask as well, like for anyone that is potentially interested in this career path, like what are some of the top skills you would say in a person that like is pursuing this? Obviously your passion and like the value you place on it, like it's so obvious just from speaking to you. I don't even feel like I need to ask you the question, but like what else, I guess? Are there specific skill sets?
Yeah. My job is not to fix anyone. Like, and who am I to say what is fixed? Like, that's such a limited scope of what I believe is right and wrong. That's not my job. I'm not the arbiter of that. But my job is to be curious about people. My job is to inspire people to be curious about themselves. My job is to support them in figuring out who they want to be. And I don't have the answers, but they have the answers. And it's my job to pull it out and help them like read themselves and understand themselves. Being curious about the human experience is huge. Like the standard non-judgmental thing, but like we can be like concerned about our clients. Like my client did something the other day and I was like, "Hey, that makes me a little worried about you. What's going on?" Like that's a judgment. Um uh Mean, no, but like you can have an opinion in therapy. I'm not like a blank slate therapist if you can't tell. All of that is really beneficial at times. So
Yeah.
curiosity, deep, deep care, but also boundaries. So I don't like this idea that therapists have to be this boundaryless, like sponge of emotions that just like absorbs everything. Like a client said something rather rude to me once, and I shared, hey, that was not okay. I'm allowed to like express that. And obviously the space is not for me to like share my wounds or share like I hate when therapists are like, oh, they're trauma dumping. No, like that's the reason why like they're there, like they're coming to therapy to share their experience. But like that doesn't mean it's a boundaryless space. So recognizing that therapists are allowed to have boundaries, they have opinions, they're human. That's a really important part of like my work and also what I like encourage my trainees
Yeah.
to know as well.
I love that. I actually my last therapist was very like I wouldn't say she's very opinionated, but she was very different than a therapist I had in the past that was very much like, oh my gosh, like well of course like which I at that time in my life I needed. And maybe she picked up on that and was giving me that because it was the first time I was in therapy. And then this last one was like, you've talked about this a lot. Like, so what? She was very direct. The direct is the word and blunt. And I needed that. And I was like, she like snapped me out of it kind of. So I love the idea of a therapist having their own personality. I think sometimes they're thought to just literally be like a listening ear. It's like, no, I wanna kind of like get your reaction to this. And then you talked about this a little bit up top with the podcast, but what are some like common conversations you're having maybe on your podcast? And I really do, certainly going to be listening to it right after we stop recording. Like GLP-1s you mentioned is like a hot topic right now. Maybe I'll ask more specifically, like, are you seeing that pop up in your practice, in like the world of eating disorders? Okay. And like, I'm sure that's so hard to navigate. Like, what are some of the challenges that you're having to reconcile in your practice with GLP-1?
The nuance of it all. Like, GLP-1s can be very healing for some people, and it can also be life-threatening to other people. And that's what's so difficult about eating disorder work, where eating an entire jar of peanut butter could be someone engaging in their eating disorder, or eating an entire jar of peanut butter could be someone engaging in recovery. This is the same thing with GLP-1s. Like, I have heard these life-changing stories about individuals who were finally able to connect with their body without all of this internal chatter. And I've also heard stories where people were prescribed it and it sent them into this like deep, deep depression and very, very severe eating disorder concerns. So I appreciating and recognizing the nuance of it all is, I think, the hardest part of the work right now.
Absolutely. I can only imagine. Another sort of rapid fire question that I wanted to ask you is the connection with mindfulness and eating. And like, yeah, like what work, if any, have you done in that space? And like, do you practice like mindfulness around your meal times? Like, I'm such a big believer in that. I do try to take some breaths because I think many of us can relate to this. You come home from a busy workday and you can eat your whole dinner in like 2 minutes and be like, I don't really like remember that. And two, or not remember it, but and two, you almost don't even feel full because you ate it so fast. Whereas if you ate it slowly and were mindful with the eating, you like feel more full.
Your mind and your body need to be working together, and when we are just plowing through our cues and the sensations we're feeling when we are eating, our mind can't let us know if we're hungry or full. So recognizing if we take a breath, if we eat with intentionality, that we're going to be able to be more connected to our body and respond to the cues that are happening. Taking that next bite, what are the flavors? What are the sensations? Do I wanna take the next bite? Do I not wanna take the next bite? How am I making that decision? And is it based off of how much I think I should be eating, or how much does my body need to be eating? And has my body even caught up to what I've eaten so far?
Hmm. Oh, I love that. If anyone listening is interested in, I guess, becoming a client of yours or recommending a peer they may know that could be a good match with you, like where can people find you?
Yeah, I'm accepting clients right now. As I said, I just opened up my own private practice. If you just Google me, Dr. Zoe Ross Nash, I should come up, and you can text me, you can call me, or you can schedule a free 15-minute consult right on my website. So I hope that I'm a very warm and empathetic therapist, and I really value like that person approach and being humans together. It's really important, while also recognizing like this is your time, this is your hour. So yeah, you can just Google me at drzoerossnash.com.
Awesome. And if you're a fitness professional, is there somewhere they can find access to that specific training?
Yeah, so if you go on to my website, drzoerossnash.com, if you click training, it'll have all of the information regarding training and sign up dates.
Well, Zoe, thank you so much for coming on the podcast. I've loved this conversation. I'm excited to listen to your podcast and have a lovely rest of your day.
Thank you so much for doing this. This is an incredible platform.
Awesome. Thank you. See ya.